Welcome back once again. You are watching part number second, and in today's video we are going to deal with the clinical psychology portion of your RML PYQ of 2021. This is the only PYQ that is available officially with you. This is the official paper, and as soon as you will complete this particular video, you will get a better idea of how you can prepare in a short span of time. Just by doing PYQs, people have cleared the ABAS or whatnot examination of MPhil entrance. Now it's your turn to change the things completely and do what is only needed, and that is it. What is needed for the preparation of yours? You just need to do the CNF books. You just need to do the CNF 7000 mocks, and that is it. Once you are done with all these things, then the paper becomes super easy for you. And lastly, what you need to do is just do the PYQs, and yes, of course, the Telegram insights are way beyond your imagination. Now, question number first starts now. In the context of schizophrenia, the term expressed emotion EE refers to. Now you might be wondering from where this particular question is coming. And as you have seen our previous video, if you are watching for the very first time, then it's completely okay. Make sure that you watch the previous video. This question is directly coming from the N book. N book stands for the Neeraj Ahuja. You will have the links given below. You can order it from there as well. Okay. So this question is directly 100% from where? This question is from your Neeraj Ahuja 100%. Okay. This is from your N book. This particular question from N book, and that chapter name is Chap 5. Okay. Chapter number 5 on schizophrenia. And don't worry, I will show you right now so you can witness right now with this particular video. But before we start, let's have a look over here. In the context of schizophrenia, what do you think is going to be the correct answer? An individual with schizophrenia who has difficulty talking about their feelings. Is it about expressed emotion? A family environment where overwhelmingly positive comments are made. Okay, now we are talking about the positive comments over here. Option number C, a lack of emotion displayed in a family. And option number D is for your a family environment where there are emotionally loaded communication patterns of a hostile nature. I hope you know the meaning of hostile. And if you are in India, you of course know the emotionally loaded communication patterns in your family. Okay, but now currently we are talking where? We are talking about only the in the context of schizophrenia, the term expressed emotion. Now somebody is expressing emotion over here. Who is that somebody? That somebody is your family over here. Okay, expressed emotion EE refers to, and where you can find it? What is the correct answer for this? The correct answer for this is the option number D. Okay, why? Because a family environment where there are emotionally loaded communication patterns of hostile nature. How you can say this? Confirm or in a more theoretical or logical way, increased expressed emotions EE, such as hostility, critical comments, emotional over involvement, and that of significant others in the family can lead to an early relapse. Okay, as you can see over here, we have discussed about EE and we are talking about schizophrenia over here. Okay, increased expressed emotion. And this is your question number first. In the context of schizophrenia, the term expressed emotion EE refers to. So what does it refers to? It refers to the emotionally loaded communication patterns of hostile nature, and where you can find it, you can simply find it in the N book if you are reading. Okay. All right. Now moving forward towards the next question, as you can see, the correct answer is option number 4 over here. According to Freud, the term hysteria or hysteria, or whatever you want to pronounce as per your comfortableness. According to Freud, the term hysteria describes. According to Freud, the term hysteria describes option number A, physical reactions to emotional trauma, a phobia of horses, an unresolved Oedipus complex, and a tendency towards oral type behavior. Before we start, do you know her? Yes or no? Maybe your answer can be yes, then it's good. If it is no, then still it's good, because this is just a random person for you who is suffering from. But before that, do you know these two? If yes, then it's okay. If not, it's still okay. Because why it is important? Because these two have what? These two have a phobia of horses. Okay. These two have phobia of horses, and this phobia of horses is called as what? It is called as equinophobia. Okay. So for next time, if they ask on this topic, what is the phobia of horses called? It is called as equinophobia. Equino coming from the Latin word, which means one's fear of horses. Okay. And now if you know her, then there is a strong association for you. Next time, equinophobia will be very, very easy for you. Okay. Now, according to Freud, the term hysteria describes. Now, this guy Freud has nothing to do with Kristen Stewart. Okay. This guy has nothing to do with this, but this guy has to do with the story of Little Hans. And this guy, Little Hans, was also having what? He was also having the phobia of horses called as equinophobia. Okay. Now, an unresolved Oedipus complex, we are talking about the psychosexual stages over here, and it has also no relation with this particular thing. And a tendency towards oral type behavior, what it is suggesting? It is suggesting for the OAPLG. What are these? These are the five stages of your psychosexual development given by Sigmund Freud. Okay, oral stage, anal stage, phallic stage, latency stage, and the genital one. So a tendency toward oral type behavior when we have fixation over here, and unresolved Oedipus complex, nothing is happening like that. Now, what does the term hysteria describe? It describes the option number first, physical reactions to emotional trauma. Okay, how your body will react, your physical reactions to emotional trauma. Let's suppose you are having any sort of trauma in your life, and how your body will do the physical reactions is called as hysteria by Sir Sigmund Freud. Okay, now you have just revised the term hysteria, what it is called. You have just revised about equinophobia, and you have a very strong association right now, and an unresolved Oedipus complex, and these two have to do with the stages of your oral, anal, phallic, latency, and genital. Now it's time for the next question. This is the third one. The term psychoactive refers to psychoactive, something which is going to be active, a drug induced hallucination, a particularly active psychopath, a drug that alters mood, cognition, and or behavior, the psychology of physical activity. Okay, what do you think is going to be the correct answer over here in this question number third? The term psychoactive refers to. Okay, and where you will find this? You will find this in the N book as well. You will find in this in the C book as well. And over here, what does the term psychoactive refers to? It is referring to the option number C or third, a drug. It is a drug that alters mood, cognition, and or behavior, perception, memory, thinking. Everything will be counted under this only. Okay, it is not about the psychology of physical activity. It is not, we are talking about any psychopath over here, or we are not talking about a drug induced hallucination as well. Where you will see this, the hallucination, you will see this hallucination in schizophrenia. And now if we are talking about schizophrenia, what you just learned about the expressed emotion. Okay, apart from that, you know the positive symptoms, you know the negative symptoms, and you know about flat affect as well. Okay, so make sure that you remember this, all these things, you revise all these things, because this is very, very important. Now moving forward to the next question. Next question says that the cardinal DSM-4 TR, just leave this question as it is. Okay, it has nothing to do with your preparation right now, because questions like these do not repeat any day. Okay, we are discussing about DSM-5 these days, so DSM-4 TR, it's just something which is none of your concern. This is third option, you can just go through it, and that is it. Okay, now bulimia nervosa is characterized by recurrent binge eating and appropriate use of compensatory behaviors. An example of a compensatory behavior is, okay, options given as use of laxatives, self-induced vomiting, excessive exercising, and all of the above. So what do you think is going to be the correct answer over here? And now you will understand the power of these 4 books and the power of doing mocks only related to this, the CANF 7000. Why? Because it will prepare you from the very basics so that you can do advanced level questions like these as well. Bulimia nervosa is characterized by recurrent binge eating. You are trying to gain weight or reduce weight. We are going to find out shortly. and inappropriate use of compensatory behaviors. An example of a compensatory behavior is, okay, so if you don't know the answer for this, let's start now. Bulimia nervosa. Bulimia nervosa, often called bulimia, is a condition. Okay, it is a condition in which a person develops a cycle of binging. Okay, so you might be ordering via Swiggy or Zomato or Zepto or Blinkit, whatever that may be. What you are doing, cycle of binging. One pizza finished, another ice cream is coming into picture, then the pastry, then the what another thing. Okay, or overeating enormous amounts of food at one sitting. Just at one sitting you are eating enormous amount of food. Okay, maybe like 2 days you are eating at once, and then using inappropriate methods, which we are talking about, the compensatory methods for avoiding weight gain. Okay. Inappropriate methods for avoiding weight gain. So what is bulimia nervosa? Eating, eating, eating. Which type of eating? It is a binge eating, and then you try to do what? You try to act smart and get to zero figure by avoiding your weight gain. Now, most individuals with bulimia engage in purging behaviors such as, and now it becomes important from here. That is why reading, just by not knowing this thing what it is, just by reading line by line and between the lines, you will be able to get the hold of it. Vomiting after the binge. Self-induced vomiting will be there. Apro over here, misuse of laxatives. If you don't know what is laxatives, just Google it, okay? Or misuse of laxatives, but some may not. Most of them do this thing deliberately. Okay. Now, but some may not, using other inappropriate methods to avoid weight gain, such as fasting the day or two after the binge, or engage in, see what is written over here, engaging in excessive exercise over here. So you got the vomiting also, you got the laxatives also, and you got the excessive exercise also, and you got this channel also. So make sure that you don't forget to subscribe and just do what is mentioned and what we are suggesting over here, because people are clearing and now it is about you. Okay, so what is the correct answer? Use of laxatives, self-induced vomiting, excessive exercising, and option number D, all of the above. So what you will mark? You will mark option number D, all of the above over here. Okay, and now talking about laxatives, what are these? These relieve constipation. So maybe someday some of you or some of your friends or family, any member is having problem of constipation. You will visit to the doctor, and what he will suggest you, he will suggest or she will suggest you the laxatives. Why? Because what they are doing, some most taken orally. Okay, so once you are engaged in bulimia nervosa, what you will do, most taken orally, so that is why it becomes easy. If you have to inject yourself, then it might be difficult. Okay, and some can be given rectally, it is not the point right now. So what is the laxatives? It is just going to ease out, it is going to soften this thing, the food you are eating, and it will come out of the way from where your body is designed. Okay, so this is the condition with bulimia nervosa, and where you just read the complete thing you only read in the bulimia, in the C book. Okay, now moving forward. Okay, that's all for today's video, but not wait, let's do one more question for the day. Okay, now dysthymic or persistent depressive disorder, PDD, differs from major depressive disorder in the following ways. Okay, now what do you think is the correct answer for this? Symptoms include hallucinations and delusional thinking. Then if we are talking about this in persistent depressive or MDD, then what the schizophrenic guys will do? Symptoms only affect women during the winter months. Okay, symptoms are more severe and last longer. Okay, symptoms are less severe but last longer. Now first of all, you can easily eliminate this thing, that this is not going to be the case, because these two are discussed in the schizophrenia. Also, you know about the EE. Also, you know about the positive symptoms. Also, you know about the negative symptoms. You know about the flat effect and neologism and whatnot. Okay, so this is the revision. Symptoms only affect women during the winter months. Interesting. This is also not the answer. Symptoms are more severe and last longer. No. What is the correct answer over here? Correct answer is your option number D. Symptoms are less severe but last longer. And where you will find this? Easy way and book only, chapter on depression. And here comes the Page number 81 for you. In the mood disorders, you will find this particular thing in the double depression head, and all your answers will be covered over here. Okay. What is double depression? This is a major depressive episode, usually acute. Major depressive episode, usually acute. Usually acute. Just focus on this word. Do you know the meaning of acute angle? I mean the acute thing. Is it small, big or large? You know that thing, acute. Superimposed on an underlying dysthymia or neurotic. For that you read the complete book and complete chapter. Okay. And the response to treatment is usually poor. Okay. We are not talking about that. But major depressive episode, usually acute. Now, what is agitated depression? This is a type of severe depression with marked motor restlessness or agitation. Where that went? Okay, now we are talking about this seasonal mood disorder. Okay, seasonal mood disorder. This is either a bipolar mood disorder or recurrent depressive episode, which tends to occur in the same season on each occasion. It is usually more commonly seen in women. Symptoms only affect women during the winter months. No, we are not talking about the depression. We are talking about the mood disorder. Why so? You can read. For example, in a bipolar seasonal mood disorder, depression would tend to occur in the same months every time, usually winter months. Okay, so depression in a see very interesting. In a bipolar seasonal mood disorder, it is bipolar means having two poles. It is having season also and mood. Okay. Depression would tend to occur in the same months every time, usually winter months. Okay, so depression will occur in the winter months, DW, while mania would occur in the months of some other season every episode, usually summer months. Okay, so you will have the DW and the SM, depression in the winters and summer the maniac episodes. Okay, over here usually summer months. So what they are talking about over here, they are talking about the seasonal mood disorder over here. Okay, and you are just witnessing right now from where these questions are coming. Now next question says that within mood disorders are the favorite one. You are witnessing third or fourth question, I guess. Two key symptoms of a manic episode are, so mania, bipolar and depression, schizophrenia are the key highlights you will witness in RML 25, 26, 27, whichever time you are watching this video. Hallucinations and flight of ideas. Why in this world will somebody with mood disorder will have hallucinations? What does the schizophrenia people will do? Okay. Distractibility and social phobia. What is social phobia called? Is it agoraphobia or is it glossophobia? Comment down below. Extremely elevated mood. Answer. And grandiose ideas. Answer. Are the two key symptoms of a manic episode. Okay. Delusional thinking and intense fear of weight gain. Delusional thinking? No. Intense fear of weight gain. Might be some nervosa, anorexia, bulimia or whatnot. Okay. So what is the correct answer over here? Correct answer is your extremely elevated mood and grandiose ideas, as you can see over here, and where you can read this thing, none other than N book. Clinical features and diagnosis. Manic episode, the lifetime this, read this. A manic episode, read this. Okay. And when you will come over here, elevated, expansive or irritable mood, euphoria, you will have moderate elevation, exhalation, severe elevation and very severe ecstasy over here. This is also a drug. And you can see where it is. There can be delusions of grandeur, grandiosity and with markedly inflated self-esteem. Okay. So it is just so simple. We are talking about the mania thing and it comes out as it is. Okay, none of these A, B or D matches. So what is the correct answer over here? Option number C, extremely elevated mood and grandiose ideas is the correct answer over here. Now with attention deficit hyperactivity disorder, which of the following is not classified as a problem relating to hyperactivity or impulsivity? Okay, this question is more than your knowledge. It is about your common sense. Of course, you have to know about what happens in ADHD. Attention is deficit and hyperactivity is available over there, this type of disorder. Which of the following is not classified as a problem relating to hyperactivity? So someone is doing activity that is hyper and impulsivity. Okay, but before we start, there is one more thing. What it is the difference between the hyper and the hypo. Okay, hyper will always mean the upside. Okay, upside in the sense Hyper, what is happening over here? Okay. Hyper will mean what? Hyper will mean the upside. Always the up. And you will be shocked to know right now, hypo means the low thing. Okay. Hypo means hypo. Hypo means hypothalamus. And from where does the hypothalamus word is coming? Hypothalamus. Why we are naming this as the hypothalamus? Because if thalamus is of this size, then hypothalamus is going to be of, it is getting same size, it is going to be like this. Okay, so this is your thalamus, this is your hypothalamus. Why? Because it is the shorter version, and I hope you got the difference between the hypo and hyper. Okay, this was the just example to make you understand the difference, and you remember this thing. Hyper is always the fast side and hypo is always the slow side. Okay, now deficit hyperactivity. What does hyperactivity will mean? Activity is on the high side. Hyperactivity. In all these events, you have to find out where is activity highly going on. Experiences difficulties in playing quietly. That person or that children is doing hyperactivity. Rather than sitting still, squirms in seat and fidgets. Hyperactivity. Talks excessively. Activity is hyper. But in this option only, doesn't appear to listen when being told something or spoken to. Okay, over here is what is deficit. Over here is attention is deficit, but we are talking about the problem relating to hyperactivity and impulsivity over here. This becomes the answer, and the correct answer is your option number D over here. Okay. Now moving towards the next question. Next question is about personality disorders are stable long-term conditions which can affect an individual's cognition, mood, interpersonal functioning, and all of the above. What do you think is the answer? Yes, absolutely. That is the correct answer over here. Long-term conditions which can affect an individual's, everything will be affected. Option number D is the correct answer over here. Okay. This one is the correct answer. Option number D, all of the above is the correct answer. Now, last question for today. Chronic alcoholism may result in which amnesic disorder? But before that, have a look at this question number 40 from the CC series of part number chapter number 13. Bulimia nervosa involves starvation, weight gain, binging and purging, memory lapse. What is going to be the answer? You know, you have to practice these basic questions, and you have seen in the RML exam also the questions are coming as it is. Binge eating disorder involves binging without purging, excessive exercise, starvation and delusions. So you have to practice the CC series or the CNF 7000, whatever you have, to do the basic questions first of all, so that you will be able to easily figure out what is happening in the real-time examination, so that you will be able to answer questions quickly without wasting any single second of your precious life. Now, chronic alcoholism may result in which amnesic disorder? This is once again directly from the CNF 7000. You will find it, the CNF books, and the correct answer over here is, your correct answer is option number A, none other than, and we have also one more video on this, COMME, where we have discussed all the major syndromes or disorders or diseases, what that is. Make sure that you watch these 4 important things which have been asked in previous examinations. Now, Korsakoff syndrome is the correct answer over here. Okay, but it is not just the chronic alcoholism we are going to discuss. It is also what? It is also a deficiency of thiamine or thiamine. Okay, it is deficiency of thiamine B1, I guess. Okay, thiamine B1 deficiency is also going to cause the Korsakoff syndrome. So are you getting why this is happening? See, let's suppose this is your brain. Brain is part of what? Brain is part of your central nervous system. Okay, so it is a disorder of your central nervous system. Which disorder? Korsakoff syndrome. Okay, now why thiamine is deficient? Why thiamine is deficient? Thiamine is deficient because of what? Alcohol. Long-term alcohol use or alcoholism will make you what? You will drink, and then suddenly thiamine will drop down and you will be got covered with the Korsakoff syndrome. Okay, so Korsakoff syndrome is the correct answer over here, and it has been repeated in every MPhil exam, and most of the time this is the only answer. I don't know why, but they want to ask only about Korsakoff. There are so many n number of syndromes, but they are asking again and again. So it is good for you. It is a good luck for you that they are asking this. You know this, and you have to apply this in the real time exam as well. Okay, so Korsakoff syndrome is the correct option over here. In which amnesic disorder, so amnesia is also going to take place, which is what, which is memory loss or brain loss or cell loss. Comment down below. Okay, now this Parkinson's disease, wait, this Parkinson's, what you remember with this parking, okay, parking, okay. So parking, what you park, you might be parking your bicycle, your car or whatever. So for bicycling, I mean for parking the car, the bicycle or the moped, what you need the motor movements, right? You need the motor movements of your body, and this is what is impaired, or by default it gets, it gets bad in your body, and that is why you are having this Parkinson's disease. Okay, so Parkinson's disease, motor voluntary movement might not be possible, tremors, shaking of hand and all those things will come into picture with your Parkinson's disease. Okay, now talking about this option number C, Pick's disease. Pick's disease is also related to your, what we can say is related to your frontotemporal, on we can write in that way, frontotemporal lobular degeneration, lobular degeneration. Okay, so this is the thing, frontal and temporal differences in between, and also lead with amnesia. And this Alzheimer is important. Why Alzheimer is associated with what? It is the two major things which are going to come into picture is the NT and AP. Okay, so what is this NT? This is your neurofibrillary tangles. Okay, sorry for the spelling, but make it correct, tangles. Okay, so it will be available, and this is your amyloid plaque. Okay, and I hope you know the meaning of plaque. Let's suppose this is, you will not be able to see, let's suppose this is your teeth. Okay, and this is your teeth, and in your teeth this yellow thing is coming into picture. Okay, what this is called? This is called as the plaque. Okay, same thing happens in your arteries or veins where the blood is flowing, and you are getting the plaque over there once again, which will lead to the CVD, cardiovascular diseases, or the ischemia or heart attack in short. Okay, now this same plaque is getting deposited where? In your brain. Wait, I can write over here. Let's see. Yes. Okay, this is getting where? This is getting deposited in your brain. And what your brain contains? It contains your n number of neurons. Okay, so there is this neuron coming like this, and this neuron, and like that. Okay, so what is happening is this plaque will get into between, and everything will get diminished in your body. Okay, because signaling will not be possible, and then every problem will arise. Okay, so this is what amyloid plaque do in your brain, and also the neurofibrillary tangles. Okay, and what is happening in Alzheimer, your brain starts to shrink. Brain will do what? It will shrink. This brain will shrink in your body, your brain will start shrinking because of the Alzheimer, and all those memory loss and all those things will come into picture. Okay, so I hope you got everything from here, and you are good to go now for the upcoming examination. And with this, we'll end this video. The correct answer over here is your option number A, Korsakoff syndrome. Alzheimer not, Pick's disease not, Parkinson's not. So with this, we'll end this video. I hope you enjoyed it. And if you enjoyed it, make sure to join the subscribe button. Click the subscribe button and join in the Telegram group, from where you can access the free study materials, the ebooks, and a lot. And if you want to enroll yourself in the complete CNF 7000 mock series, then this is a good time, and you can just practice these questions, do the basics properly, so that you will be able to solve questions like these. Thank you, and have a nice day ahead.